Hello once again, from my house to your house. I'm Marie Moss, your church nurse. So the stay home, stay safe order has been extended for 3 more weeks. How are you going to respond to this? You've done a great job so far of practicing the things that we need to do, the hand washing, the social distancing. We need to continue to do those good practices. Huron County has had only a handful of cases, and we're so thankful for that. And a lot of the reason of that is because you're doing the right thing. Keep up the good work. But what's it going to mean as a church when we do get together? How are we going to be able to manage that? The health advisory team has been meeting the last couple weeks, every week, trying to figure out how can we, again, meet safely and regularly and practice worship. One of the new guidelines that we had this week is that everyone needs to wear something over their face whenever we're out in public. Whenever we're in an enclosed building, our mouth and our nose needs to be covered. This can be just a handkerchief or a scarf, or it can be a mask. So if you need a mask, or if you know of someone who needs one, please stop by the church. On the ramp there at church is a cooler, and in there the mask makers have made quite a few, and there is a good supply. Yesterday when I stopped to pick up some, there was a good supply there. So help yourself, and let Charlene know if you need some more, and she'll resupply the stash. So how are you doing? Do you think that you might have COVID, or that you maybe were exposed to it? There is a link to the CDC site on the newsletter each week that you can use to check your symptoms. Maybe it is COVID, maybe it's just your seasonal allergies that's making you cough and sneeze. You can use that to see if you need to contact your healthcare provider and get the testing. They're really encouraging us to get tested if we are in doubt at all. They say the more testing we can do, the more they can track this disease and get to the bottom of it. But please take care of yourself in other areas as well. You know, we're still going to have the high blood pressure, the diabetes, all those kinds of things are still present. And we need to practice good care and not neglect those things. So if you've fallen and hurt yourself, or if you have chest pain, please either contact your family doctor or call the ambulance, whatever's appropriate. Don't neglect the care of other things just because we're so afraid of the COVID. They have separate areas where they can keep the people who have COVID separate from the ER and the other people who are visiting for other issues. How are you doing emotionally? One of the things that's been helping me is being outside regularly. Goldie Swarzentrooper is my role model for this. She goes outside every day for a walk, gets some exercise. In the winter, those days when it's icy, she has a treadmill downstairs that she does her walk on. But these days, she's outside every day getting her walk. Goldie contributes a lot of her physical health and her mental health because she's done this for years and years. So, this week, get outside. Go for a hike, go for a bike ride, go for a walk. Or maybe just sit in a chair outside. The fresh air, the sunshine, the breeze will help clear your mind and nourish your body as well. Today, more than ever, it's time to trust Jesus and wash your hands.